In this video of the Rethinking Anatomy series, we're going to be looking at the rhomboid muscles, the anatomy of them and what they technically do. Now, the rhomboids, we have the rhomboids major and minor, and both of them attach from C7, so we have the 7th cervical vertebra, and they go on the spinous processes down to the 5th thoracic vertebra. They attach into the medial border of the scapula along here like so. Now, from a pure muscle function point of view, as if they were to contract, they would lead to elevation and retraction of the scapula, so the scapula going backwards and elevating like that. Now, the reason we want to look at this muscle is because when there is either tightness or restrictions around the C7, T1 area, this can lead to things like restrictions in neck movement, headaches, and also impact the way somebody's scapula and shoulders move when they're doing pressing in the gym. So in other words, if we can get these muscles to target well, target these muscles well, we can have a really positive impact on somebody's upper body mechanics. So one thing we're going to look at today is what the rhomboids will typically get exposed to from a gravitational point of view and from a central nervous system point of view. So in other words, what is the signal the brain is saying to this muscle? Now, this attachment site here, so basically where the rhomboids go up, there are also muscles such as the splenius capitis, which is a muscle that goes into the occiput, into the back of the skull here, which has a similar attachment site. So we can say from a myofascial or a fascial point of view that there is a connection from this left side here into the right side of the occiput in a fan or in a cross-like motion. Now, if somebody is at a desk and their head is moving forwards, so their head is going in that direction, if we imagine that the back of the head now is attached to the rhomboids, what the brain will be saying is that it needs concentric activity here to basically act as a way of pulling the head backwards, because gravity is trying to take us forwards, so these muscles here are constantly working concentrically, so basically trying to offset gravity by pulling the head back and attaching into there. From a soft tissue point of view, it's very, very common that people will be very sore around this area of this scapula just for that reason alone. There is increased concentric activity in the brain, which is creating what people commonly refer to as knots and adhesions in the muscle. So, if we wanted to improve this, we obviously have to look at it from two perspectives. The first one is reducing the exposure, so educating people about desk posture, forward head carriage, and not going too long where they're excessively having their head away from the centre of mass. But then secondly is that if these are constantly concentric and they're creating issues around here, we need to find a way of inhibiting this muscle. Now, the problem you have is that if we want to teach these muscles how to work eccentrically, we would need to concentrically load them and then slowly take them into an eccentric range. But the problem with that is that due to their anatomy based on here, doing things like shrugs, although good, they're not exactly going to be practical, because as heavy as we go or as slowly as we go, it's not going to be the most efficient way of training them. So what we can do is we can explore further around into other anatomical structures such as the serratus anterior and the external obliques, and look at ways at how we can get these to contract as a way of inhibiting these muscles. So in other words, we want muscles here to eccentrically lengthen. We want to change the position of the occiput and the skull, so we take some pressure off this region, and we're going to do that by not necessarily training the muscles here, but training the muscles further away, further down the chain, so we can have an inhibitory effect around here.
So this is a simple drill that we can do to inhibit the rhomboids but also get the neck to mobilise. What you're going to do is we're going to place we want basically the cable to be a continuation of the client's arm. So if we make that there, so now where you can see where the ball is, that is at the back of the elbow. And what we're going to do is just very simply get them to do a press so it's out in front of them like that and bring it down. And we've got these, what we'd say, when we say imaginary fibres, it's where the serratus anterior fibres are going. So if we hold that in just a position like this, and I'm just going to increase the height of the cable slightly for Will, just so again, we want these to target this cable to go through the serratus anterior. Then what he's going to do is that because we want these to lengthen, we need them to protract and depress, because if they elevate and retract, we'll do the opposite. So push that forward and then depress the shoulder slightly, so you're going down through there. That's going to create basically it's an inhibition that these muscles now have to stretch. And now all Will's going to do is just rotate his head from side to side. More specifically, when he looks over his left shoulder, he'll feel like a stretch and pull in the occiput, which is basically the back of the head. And what we do is just tuck your chin to your chest, just find different ranges and find a range for yourself where you really feel that bit of that increase in build up. Which way for you is it?
Any head flexion.
Any head flexion, yeah. And you really feel your occiput at the back of your head working. Yeah. So to get that release, so in other words, to get that release and open up there, we're just going to push this forward here and hold that, so he's got that protraction. What he's getting is that we need to rotate that shoulder forward here, so we've actually, that's it, good. So we're getting some real work in the serratus anterior. And then I'll just say, just find that position where you find it, that find there's a restriction, and just do some nice neck mobilization movements like that. For again, this can be 30 to 60 seconds, but it's just going to take that compression away from the back of the head. Now, this is good from a therapeutic point of view. If someone's been at a desk all day, this is a great drill you could start the session off with. But remembering as well is if those rhomboids are tight, so you can take that there, bud. So then let that relax. Is that if those rhomboids have got this this concentric signal to basically be tight, we're going to have retraction and we're going to have elevation. Retraction and elevation being shoulders like this is going to stop us from getting that press in motion. So in other words, tight rhomboids are going to prevent us from getting a good contraction in our chest for pressing movements, because the scapula can't move in the optimal direction.